Thanks for having me here, everybody. It's fun to do this. I could talk about psychedelics all day long. So if people enjoy this, I'm happy to come back. Just a little bit about me, born and raised in Los Angeles, UCLA Medical School. I'm trained as an oncologist. I'm a cancer doctor. That's what I did at Yale. But in 2018, I went back to school and I spent a year studying at the California Institute of Integral Studies in San Francisco, where they had developed the first program in the world to train doctors and therapists in the art of using psychedelic medicines. And basically, what we're doing with these medicines, to kind of boil it all down, is that when a person's suffering from some type of psychological discomfort, whether it's anxiety or depression or obsessions or PTSD, usually what's going on is that there's some kind of disruption down in the patient's subconscious. And we go to therapists so that the therapists can help us work through that. But the problem is that when you sit down on your therapist's couch and they say, "What's wrong?" all you can report is how you're feeling. And you might report the circumstances that are going on in your life, like, well, my girlfriend of a decade just dumped me, so I'm depressed. Well, there's much more to what's going on than the circumstance. But when you're sitting on your therapist's couch trying to talk about where your depression's coming from, it can be very difficult because there's subconscious issues that you're simply not aware of. And what we've found with working with psychedelics, with work dating back to the 1950s, believe it or not, is that when you give a patient a psychedelic medicine, it can kind of stir the pot. It brings up a lot of energy of what's going on in the subconscious, and that can bring that up into your conscious mind, so that when you're then engaging with a therapist, you have a bunch of material to go over. And what we've found is that at the clinic I work at, there's a clinic in Santa Monica. It's called Field Trip Health, and I'm the medical director there. And at that clinic, we use ketamine paired with psychotherapy. And we have found that in general, our patients, about 80% of our patients, including the ones who've been in therapy for years, about 80% of the patients, when they go through 6 cycles of having a ketamine injection that's paired with psychotherapy, that repeating that cycle 6 times, 80% of our patients have significant improvement in their symptoms of depression or anxiety or addiction. And that's a gigantic step forward compared to traditional psychotherapy. You know, if any of you have ever been in therapy, you can know that it's a long process, that it's very hard to make progress. But adding psychedelic medicines into the mix is literally like supercharging the process. And so that's one method that we can use psychedelics for, and it doesn't have to be ketamine. MDMA is amazing, psilocybin is amazing, LSD is amazing, ayahuasca is amazing. The reason that my crew and me at our field trip clinic are exclusively using ketamine is because that's the only one of all these medicines right now that's legal. All the other medicines that I've mentioned are felonies to possess, and it's felony to give to a patient. So a legitimate doctor is it's very, very difficult to adopt some of those other medicines into a clinical practice. But ketamine was FDA approved back in the 60s, and it's got a very, very long track record of safety. And I was telling Gina and some of the other folks that where ketamine really proved its safety was on the battlefield of Vietnam. There were army medics who could just give a dozen wounded soldiers ketamine. And unlike morphine or an opioid that was used in older military conflicts, where patients really needed to be supervised very closely, and on a battlefield, that's just not practical. Ketamine, on the other hand, has such a high safety profile that a medic could give a dozen shots of ketamine and then focus on one person. Well, since those early days, ketamine has been widely adopted in the world of anesthesia, but as a single agent, most anesthesiologists are a little reluctant to give it to adults because of something Gina was asking about. Gina mentioned something that recreational ketamine users can refer to as a Khole. And so let's step back and talk about like what ketamine does and you know, what is a Khole and why do anesthesiologists not like that? Ketamine is not considered a classic psychedelic. Ketamine is in a family of medicines called dissociatives. And basically what that does is it's sort of, just imagine if there was some switch that could disconnect your thoughts and your emotions from your sensory perceptions. It's like your brain's still working, you can think, and you may have feelings, but you might not feel your arm and your leg because the nervous system input coming from your arm and your leg going up into your brain is getting blocked by ketamine. And that's why it's an excellent battlefield anesthetic. You know, if you've got half your arm blown off, you don't really know it's bothering you when you're in a Khole. But from an anesthesiologist point of view, they saw being in this dark space where your vision can kind of turn off, right? All of your sensations are unplugged. And sometimes you might not be able to see, or your visual field's very distorted. And to an anesthesiologist, that seems like a really bad side effect. And that's, you know, Gina, when you were saying, you know, going into a Khole, it can be scary. Yeah, it can be absolutely scary when you take so much ketamine that your conscious mind is unplugged from your body. Being in that state, and the deepest state of being like that, we call a Khole, it literally can feel like you're a disembodied voice in the empty void of black space.
I mean, I didn't find it frightening. I found it, what I was surprised that it wasn't frightening and that I had all these epiphanies in it. Whereas other people had told me, oh, it's really scary, but it actually didn't scare me.
Yeah, you're hitting on some really important distinctions. So if a person is psychologically healthy and they can remind themselves, oh, I'm in this weird space because I took some medicine and it's working, this is where I chose to be, it can be an absolutely extraordinary experience. It can be fun, it can be interesting, but it can also open up your mind to psychological insights that might have been causing blocks in your life, you know, blocks in a relationship, blocks in your career. But being in that ketamine space can create what I like to refer to as an arm's length distance between your thoughts and yourself. Because if my next door neighbor is upset because their mail didn't get delivered, I don't bind myself to their upset. It doesn't make me upset that they didn't get their mail. But if I didn't get my mail and that makes me upset, an alternative for me is to say, Randy, rather than thinking like my neighbor and getting trapped into that emotional unhappiness because something happened that I didn't want, what ketamine allows you to do is to look at your own thoughts, like I didn't get my mail, with the same dispassion as I can look at my neighbor's thoughts of her not getting her mail. And when you can kind of separate yourself out from, instead of being the thinker of the thoughts, you just perceive yourself as an observer of somebody who's thinking thoughts. Just that tiny little distinction can completely change the way you perceive being a human being. And it can make levels of suffering in your life go way, way, way down, because rather than feeling like the world's doing something to you, you just start narrating stories about the world and you don't have an emotional connection to the negative parts of it. Now, if this sounds confusing, don't worry about it. There are workshops that can take 6 months for people to really understand what I'm talking about in terms of kind of building an arm's length distance from your thoughts. And it's also something that's very, very hard to wrap your mind around intellectually. Just like I can't describe a flavor to you through my words. The only way for you to know a flavor is to taste it. I can't explain to anybody what it's like to develop an arm's length relationship from one's thoughts. It's something that you have to experience for yourself. But when you do that for the first time, it's completely life-changing. Because when you come back to your body out of the medicine experience, you can say, oh my God, I had a glimpse of this superpower where unpleasant thoughts in my head didn't convert into unpleasant feelings in my heart. And going through life having that as a skill is really transformative. And so to go back to the Khole, Gina, you're absolutely right. It can be a place that's very, very scary for people who aren't emotionally prepared for that. But that's exactly why me and my therapy team uses ketamine in a very controlled environment. We don't just write somebody a prescription and go take 2 ketamines and call me in the morning. At field trip, when we're giving ketamine, patients are sitting right next to a psychotherapist, where they're sitting next to a doctor. And if they start having fear or panic, somebody's right there to sort of remind them that they're safe and that they chose to be in that space. And the purpose of being in that space is to open up their mind and their heart to healing. Just having that little bit of guidance can take what might be called a bad trip and turn it into something that's got extraordinary value for healing.
So let me ask you, so the healing in your, Eva is you're saying is basically just the act of separating your thoughts from your feelings is where the healing comes from? Where does the healing come from?
Yeah, well, so there's 2 methodologies that I would say that ketamine or any psychedelic can induce healing. The first thing is what I was talking about, where it can stir up the subconscious. Like if a person's going to therapy and they've been in therapy for months and they're feeling like they're stuck, having some ketamine with that therapy, even though it might not affect the way they perceive their thoughts, it might not have anything to do with that. Just getting that ketamine in a psychotherapeutic context can bubble stuff up out of the subconscious and really kind of fast track that psychotherapy work. So that's one way that ketamine can help. The other way that ketamine can help, and this is where my area of clinical interest is in, much more than psychotherapy, it's helping a human being identify as the observer of their thoughts, not as the thinker. Because here's another way to explain it. When we think, a lot of us experience the act of thinking is almost like having a conversation with ourselves. Let's say you're upset at your partner and you're like, I'm going to have a talk with that person. And you kind of play in your head what you might say to them. You kind of pre-practice the conversation. Well, in that act of thinking, you can notice that there's a little voice in your head talking, and there's another part of you that's listening. And we think of both of those parts as kind of the same thing. But the real deep beauty that comes from psychedelic medicine exploration, where you're doing it in a therapeutic context, where there's an eye mask over your head, ambient noise is blocked out by headphones, you're in a chair or a bed that's really supporting you, so you're not feeling very much touch stimulation. When you're in that isolated environment, you really do have your sense of I, like that thing that you refer to when you use the first person singular pronoun I, that sinks into that part that's doing the listening when you're having a conversation in your head. And the part that's doing the talking, you kind of perceive that as something that's different than the listener. And just noticing that there's a difference between the thinker and the listener is a profound step forward in in psychedelic healing because it helps you reframe who you are as a person and how your negative thoughts relate to you. And if this is really confusing, don't worry about it, because like I said, this is something that is very, very difficult for a normal human being to wrap their head around.
I just want to clarify, you're saying that from your perspective, the actual I, the ego, is the listener, not the thought generator. Is that correct?
So now we're getting into some psychotherapeutic terminology, and it gets even more confusing when you use words like I and ego, because every author and every school of thought has their own sense of how they use those words. The way I use those words, I refer to the I as the listener and the ego as the thinker. And that's actually supported by variety of types of neuropsychiatric research. We've got EEG studies where you put electrodes all over people's head and you watch what their brain's doing when they're thinking. We've also done functional MRI studies where you put somebody in an MRI and you watch how their brain mechanisms are working when they're thinking. And it turns out that when you're meditating and your mind goes silent, the I that's listening is always present, but there's no talking in the head. But then as soon as the ego starts getting activated, that voice chatter starts climbing up again. And we can literally see which parts of the brain are talking to each other to create the internal chatter that we all perceive as thinking.
Wow.
And so, yeah, in my vernacular, I call that the ego, but it's distinctly different than the part that's listening to that chatter.
And when you take the ketamine, I assume they've done studies like what actually happens in your brain.
No, here's a secret, okay? Any doctor who tells you that they know the answer to that question, they're blowing smoke up your dress. Nobody knows what the hell's going on. With psilocybin and LSD, we can say, oh, well, it activates the serotonin receptor. And with ketamine, what we know is that there's a type of GABA receptor called an NMDA receptor, and ketamine blocks the activity of that NMDA receptor. So does nitrous oxide. For you burners that have enjoyed a whippet or two, it's the same exact chemistry as ketamine. But that's all we know. That's really all we know. We don't have any idea what all the complicated steps are downstream from that receptor getting blocked. But we do know that, as you said, Gina, when patients are on ketamine in a highly supportive therapeutic container, they can have profound insights about their life, which then, when brought into a therapeutic context and worked on with a therapist, can be life-changing.
So I think that there's a question here about making rash decisions. Does something like ketamine make you sort of give you the impetus to make drastic life-changing decisions? Is it that kind of a substance?
No, I mean, put it this way. I know a lot of burners who share with their friends, don't make any big life decisions within, some period of time when you get back from Burning Man. And I think that that's really good advice, because Burning Man can show you such a different way of being a person, such a different way of interacting in the world with other people than what's normal, that it can really just kind of rock your foundations and make you question how you want to be in the world. And any psychotherapeutic growth can also have that kind of trigger where it makes you ask, hey, is this relationship really right for me? Is this job really right for me? And so the answer to C's question is no, it won't make you make rash decisions, but yes, it might open you up to seeing answers to seeing new answers to old questions that might end up provoking you to change what you're doing. But never would it be, oh, I took drugs and I made a bad decision and now I have this bad consequence. That just doesn't happen.
Thank you. Somebody had another question about getting safely off antidepressants. I know that like with psilocybin, you can't, like, it doesn't really work if you're on antidepressants. Is that SSRIs? Is that the same with ketamine?
Well, let's go back to that comment. I had my life saved by mushrooms when I was on antidepressants. I was a really well-behaved kid in terms of drugs. I never smoked pot until I was 33 years old, and I hated it. And so the very first time I was actually participating in a medicine ceremony, it wasn't really even a ceremony. It was come to some friend's house and take some medicine. And all I knew about mushrooms is that they can kill you, because you can get hepatotoxic death caps that look like psilocybes. And I was on a lot of antidepressant medicines then. And I woke up the next day from my journey completely cured of a suicidal depression. So my point is that these antidepressants can work while patients are on antidepressants, but what we do know is that the effect of these psychedelic medicines can be muted somewhat by an SSRI. And so you might get more of benefit if the patient weans off their medicines. But for some people who are really dependent on antidepressants, they can't wean off their medicine. So the answer to Caitlin is no, a person does not need to get off antidepressants before they take ketamine. Now, some of the other medicines, it's a little bit more challenging because most antidepressants work on serotonin, and LSD and psilocybin work on serotonin. But because ketamine's working on the NMDA receptor, there doesn't seem to be any problem at all combining things like Prozac or Effexor or any of the antidepressants people have heard of with ketamine therapy. We see patients in the field trip clinic who are on both medicines all the time.
Great. And there's a question about, I guess, the molecular structure of ketamine, or where does it come from? I mean, I'm sort of curious, how did they find it? I assume it was accidental, because it doesn't have a plant origin.
Yeah, it's fully synthetic. It does not come from a plant, and it was discovered by organic chemists whose job it is to go in a lab and make different chemicals and try them on plants and animals and see what happens. And that's exactly how LSD got invented. That's a fully synthetic. Well, actually, it might be semi-synthetic. It might start from an ergot residue, but the point is that there are organic chemists in this world whose job it is to just make chemicals and test them out. And that's exactly what happened with ketamine. It's fully synthetic. It's from a lab.
And then there's some questions about how the therapeutic protocol that you do at Field Trip works. 6 sessions, cycles over how many weeks, and also what's the difference between the at-home and the in-clinic. You do a virtual program that people take it at home, but it sounds like it's not as strong as the one that they go to the clinic for.
Well, there's a lot of questions in there, so let's hit them one by one. So G asked the question, 6 cycles over how many weeks? So most patients at Field Trip do 4 or 6 cycles, but it's not just the cycles. The whole process is started by an intake with a nurse psychiatrist. So we basically put a patient through a complete psychiatric evaluation, and that's really just for safety. It's to make sure that there's nothing going on with the patient that might make ketamine unsafe for them, either from a physical, medical, or psychological perspective. But in general, the process of work is that the ketamine sessions are done once or twice a week. So it can basically be 3 weeks to a month and a half for a complete course of work. And G also asked for me to describe the center's virtual program. And Jean, I think that may be what you were
You have like an at-home one and an in-clinic one, right?
Yeah, so that's literally brand new. Field Trips at Home program is so new that I spent a couple hours today being trained on how to use our new medical record keeping system for this new avenue that we're doing. So basically, the in-house process, the process of coming into the clinic, getting a medical evaluation, getting an injection, sitting with a therapist, it's very expensive. And some people can't afford it. Some people don't want to make the time, or they might live on, in Pasadena, and our clinic's in Santa Monica, and getting across LA is impossible. And so what we're doing is we're creating an at-home program. It's called I don't even know what it's called now. The name have changed a few times. Flexible, I think, is the name of the program. And basically the flexible program at Field Trip will mail each patient 6 dissolvable ketamine tablets. And the patients can use those ketamine tablets in conjunction with online learning resources, or in-office resources if they want to come into the clinic. So in the clinic, we're going to be offering sound baths, meditations, group therapy. We're also going to offer some teaching programs. And for whatever components of those that translate well to video, we're going to record a lot of those programs and then have them in a video library. So what I'm really excited to do, and my passion is talking about this distinction between the thinker of thoughts and the listener of the thoughts. I mean, there's so much power in really understanding that, and so much improvement in a human being's sense of well-being, in knowing, this knowledge that I'm going to basically put together a program that's probably going to take 6 to 8 months of lectures and interactive sessions to kind of help teach some of this. So that's kind of the gist of this new program for folks who want to do things at home.
See a question about whether it's addictive, ketamine.
Great question. So let me, to address the issue of addiction, what I'd like to do is explain the DEA's system of scheduling. So that the federal government has a system that they call drug scheduling, and there's 5 levels, 1 through 5. And level 1, schedule 1, is things like heroin. It's things that have no medical value, are extremely addictive, very dangerous. And what's interesting is schedule 2 is really dangerous, highly addictive, but there's some medical value, so we'll let you use it. Now, what's absolutely crazy about the federal government's policy is that cocaine and methamphetamine are schedule 2, yet what's considered more dangerous, more addictive, is naturally grown marijuana. It's just utterly insane. And the craziest thing about the marijuana criminalization is that level 3, so it's below level 2, that's considered kind of mildly addictive, but not so bad that we need to worry about patients. And a doctor like me doesn't need to fill out some special triplicate form to get it prescribed. I can literally just phone it into a pharmacy. So even though the marijuana plant is a felony, the pure THC that's in a marijuana plant, if it's made in a laboratory, it's schedule 3. It's barely considered worrisome. And that's the same class that ketamine's in. Ketamine is considered a scheduled 3 controlled substance. And regarding its addiction, it's not considered physiologically addictive the way an opiate is, the way nicotine is, the way cocaine is. Ketamine can be it can have a psychological component to an addiction, but that's really not different than somebody who's addicted to sex, or somebody who's addicted to shopping or gambling or eating. I mean, there's a lot of other addictions that are more than the chemical, property of that medicine. And that's the umbrella that ketamine falls in. It's not addictive like tobacco or heroin, but it is addictive like sex or shopping to those people who are susceptible.
It
You
says,
talk a lot about psychological wellness, supportive to a good experience, yet beings looking to use ketamine for recovery are often not of sound mind. Do you provide a screening and or preparatory session to bring a being into deeper awareness of self before the medicinal session? Yeah, Drasman, that's a great question. And so to go back to what I was talking about, the flow, at least at Field Trip, I can't speak for every psychedelic medicine clinic, but at Field Trip, the way that we handle that is the very first encounter that a patient has is with a psychiatric nurse practitioner. And that patient goes through a complete psychiatric evaluation and a complete medical evaluation so that we can assess for things like substance use. And there are certain patients with certain substance use disorders where ketamine treatment can be a treatment for the substance use disorder. But there are other patients where the predilection for a substance use disorder is a bit of a risk factor, and giving that patient ketamine could trigger some, use problem. And so that kind of fine tuning gets done by a psychiatrist. And then once the patient passes that screening, then they go talk to a therapist for upwards of an hour. And the therapist then does a psychological screening, which is different than a psychiatric screening. So psychiatric screening is an MD thing or a medical training, and a psychological screening is through a therapist. So that there's a second layer of screening. And when the therapist feels comfortable that the patient's appropriate, then the patient comes into the clinic and gets medicine. So Drasman, yeah, there's a lot of layers of evaluation. And as well as evaluation, what that time with the practitioners is doing is it's creating a safe container for our patients to feel cared for and loved and comforted, so that they're comfortable letting go of their consciousness and having a consciousness changing experience. Because in order to sink into that ketamine space or any psychedelic space, you really, really need to trust the people who are taking care of you. So it's all built into the process.
I'm curious, you say you do this with six cycles, and it's like, what is the expectation in terms of how, each one, are you going deeper each time you do it? Like, as a sort of psychedelic journey, what is the psychedelic journey that you expect? Like, why do you need 6? Why isn't one deep enough? What happens, or what's the expectation of the journey?
Yeah, these are great questions, Gina. So the expectation of the journey can depend on a variety of factors, some of which are how much work has the person done before they came to us, and another is how much psychedelic experience does this person have, and not just psychedelic experience, but psychedelic, psychological work. Because it's one thing to take some mushrooms in a therapeutic healing ceremony, and it's another thing to do mushrooms out on the playa. They're two very, very different experiences. And all of those different nuances get factored into a patient's arc of healing. Dose can be another factor. So patients on a low dose of ketamine typically don't go into like a psychedelic state, but that's where they get to that, stirring the pot of the subconscious, and stuff bubbles up. And so sometimes what we'll do with patients when they come into Field Trip is we'll do basically a 2-stage journey. The first stage is a low dose, like 10 or 15 milligrams. And then the patient will talk with their therapist for 30 minutes or so. And then I'll come in and give them another 80 milligrams and send them off into a totally psychedelic experience where the patient can't communicate. They're, covered with an eye shade, in their headphones, totally isolated in their own like conscious environment. But then when they come out of that, they feel very, very primed to start discussing things with their therapist that might have come up as an image or an emotion, basically just more pot stirring. So the point is, there's a lot of different ways that patients can get benefit from these medicines, and a lot of it has to do with where the patient's at, what kind of dose we give them, what kind of preparation they have.
So what is the expectation that over the 6 cycles, you'll just keep going deeper and deeper? Is that typically what happens? Is there a typical arc or not so much?
Yeah, there is. Like, so for most patients who are sort of naive to psychedelics, the first journey or two, really the purpose of that, we don't expect a lot of healing in that first journey or two. What we're really doing is helping the patient get comfortable in a completely new space. And then third or fourth patients, it's kind of like dating, right? The very first time you go out on a date with somebody, you don't really know them. And so there's a little bit of a sniffing the other dog's butt kind of thing. And that's what patients are doing with ketamine their first 1 or 2 times. They're just sort of getting to know the spirit of the medicine. And then the third or fourth treatment, they really start engaging with the medicine. And we noticed that by around the fourth experience, there's this noticeable shift in patients. There's a shift in their sense of well-being, and there's a shift in the way that they work with the medicine. So that there very, very much is an arc. The arc is the answer to your question. And what we've found by treating hundreds and hundreds of patients is that 6 journeys is kind of the sweet spot where most people tend to get the most bang for their buck and the most benefit for the effort that they put in. For most people, 4 is not enough, and more than 6 is, they're starting to be a diminishing point of return because they got a lot of value out of it, right? If your depression, if your happiness score goes from 2 to an 8, there's very little room, to keep improving. It's really hard to get to a 9. And that's probably something more than mushrooms or ketamine to get you up to a 9 or a 10 in terms of your life happiness. But that big jump from a 4 to a 7, that can happen in 6 sessions. Answer some other questions. So G asked, do you have to live in California for the home program? The answer is that I don't know. This is still relatively new, and I think that we're right now open to patients in Washington State and California, but I'm not sure. But honestly, the way to find out is to just go to the fieldtriphealth.com website, and you'll figure out where to go, and just click on buttons, and the website will answer your question better than I can. All right. Is it safe to take ketamine pills at home? You said it's safe in the clinic because the doctor's there. If you have a bad trip, they can guide it. What if someone has a bad trip at home? Great question. So the answer is, yeah, it's very safe to take ketamine at home from a medical perspective. So nobody's going to take ketamine and then have a stroke or a heart attack. But what can be problematic is if you're on ketamine, you can make some bad decisions. Like you can say, oh, I want to go hang out in the middle of the street. Well, your higher cognition isn't taking good care of you. And so the way that we're dealing with that with the at-home program is that every person who's using ketamine at home has an identified sitter who doesn't have to be a medical person, but who just is in that person's home when they're taking the medicine so that they can, call 911 if there's a problem, or just tell the patient, hey, don't walk outside, don't go into the street, just little safety stuff like that, or walk them to the bathroom if they feel a little wobbly on their feet and they need some help getting into the bathroom. So a home sitter who's basically a friend or family is part of the program. All right. Oregon is legalizing psilocybin, decriminalizing many of the psychedelics in many cities. Yeah, we were just talking about decriminalization before we started, and it's really clear, or it's really important that people understand that when there are states like Oregon and municipalities like Denver, Ann Arbor, Oakland, and Santa Cruz who have decriminalized psilocybin, that only means that those local municipalities have told their police officers, don't, spend a lot of resources doing an investigation on the local mushroom dealer. Leave that guy alone. But it doesn't mean that these substances are federally legal. So if you're a doctor, you might have trouble with your state medical board renewing your medical license if they find out you're giving out psilocybin, even in Oregon. Or the DEA might say, we're not going to renew your DEA registration to prescribe controlled substances because, we've got reports that you're giving out psilocybin. So the local and state referendums that have tried to chip away at the criminalization of this are still have a long way to go. And then circling back to Carl Hart, yeah, I'm very well aware of his work. He and I have one major point of disagreement. He tends to not create a distinction of good drugs and bad drugs, whereas I do. I know a lot of people who have said, I'm a much better person and my life is way better because I derive some spiritual growth from mushroom work, or I derive psychological growth from LSD work. I don't know a single person who said, man, my life got a lot better when I started shooting heroin. Or I don't know a single person who said, man, as soon as I started snorting coke, my life got better. There are just some nasty drugs with nasty energies that hurt people. And I would throw stimulants like cocaine, methamphetamine, and depressants, like opioids, into the box of dangerous medicines that you really should not experiment with. And then there are safe medicines like cannabis and psilocybin and ketamine that, when used responsibly, can be remarkably healing. All right. Okay. So what about integration and follow-up? If ketamine helps release trapped trauma, this release tends to happen over time, or months or years, as the body processes each layer. Yeah, that is absolutely correct. And so that's exactly why at Field Trip, our process isn't just come in and get some ketamine. It's come in, get some ketamine, and at the beginning of the ketamine journey, if I've given you a low dose, talk to your therapist. Or at the end of your journey, as you're coming out of the ketamine, talk to the therapist. And then an appointment is scheduled for the next day or two for that patient to hook up again with the therapist to do integration and processing. And that's where really the real healing comes in. It's when a patient figures out how to incorporate the insights that they had while in the psychedelic space, when they figure out how to incorporate that into how you're living, the quality of your life goes up. So yeah, integration is probably the most important aspect of this work. All right. So Hannah asked, do you have any advice for therapists who are supporting people to integrate their ketamine experiences? I do. And the first piece of advice I'd give any therapist who's interested in helping ketamine patients integrate is for that therapist to have undergone a therapeutic ketamine experience. Because even if you've, taken some ketamine at a party or out at Burning Man or whatever, it's entirely different to be in a safe, controlled, healing, sacred space with all of your senses blocked out, eye, ears, touch, all blocked out, where you're really just going internally. I think it's really, really critical for a therapist who's going to do work with this medicine to understand what the patient's experienced. And we offer that at Field Trip. So if you want to, Hannah, if you're in either LA or San Diego, I'd be more than happy to kind of make that happen for you. Okay. Well, let's see. Dresman, yes, integration is the most important part of any and all medicine journeys. Yeah, I fully believe that. I mean, I'm not saying that patients can't get benefit from a psychedelic journey without integration, because I'm a case in point. I did zero integration when mushrooms cured me from a suicidal depression. But I'm an anomaly. I know now, looking back, that I got really, really lucky. But for the vast majority of people who benefit from these medicines, the majority of the growth and benefit comes from talking about the experience.
There's a question about, does it affect your job performance? Like, how does it affect the rest of your life?
Well, I'd say it affects life performance. Our job is just one thing that we do. But the bottom line is that a course of this work, in the most generic terms possible, can improve a person's sense of well-being. And if those words don't make much sense, another way that I like to describe this work is I say that what we're doing is we're treating NHC. Doctors have all kinds of abbreviations for diseases, right? Well, to me, the main thing that I help people with is a disease called NHC, and that stands for normal human condition. Because every single one of us suffers. We have, we're not 10 out of 10 happiness all day long, every day. The human experience is just a fluctuation in our sense of well-being, and we've got good days and we all have bad days. And whatever your average is at, if it's not consistently averaging at a 7 or an 8, you can get up there with a course of psychedelic medicine work. And so even if, a person's at a 5, I wouldn't say that they're depressed, but they have room for improvement. And so that's really, in my opinion, the biggest value of these medicines is just whatever your baseline sense of well-being is at, we can raise it.
It's beautiful. Beautiful. I feel like I had that kind of experience also with microdosing on psilocybin, just like kind of raising the baseline a little bit. Yeah.
And the difference is that when you're microdosing, you're really just sort of using the medicine as a medicine. It's just like taking Prozac every day, but you're taking, LSD or shrooms like every couple days. But the point is, you're not really so much fixing something as medicating it. But when you take a journey and you go deep inside yourself and explore yourself and come back out, well, then you've actually changed something.
Wow.
Fixed it.
Very cool. This has been wonderful, Randy. I think what I'm thinking we'll do now is I really want to get an opportunity for people to talk and meet each other. I think what I'm going to do is I'm going to turn off the recording